Dr. Newton, thank you very much for joining us here on Health Connection. It's a real pleasure to have you. Our topic, our segment is entitled Palliative Care, Buzzwords, a Real Quality of Life Improvement. So let's start with the definition. What is palliative care?
Palliative care is a specialty of medicine that is designed to help people that have serious illness. And so I think that the best way to think of palliative care is as a specialty, just like you would think of cardiology for the heart or pulmonology for the lungs. Palliative care helps to provide an overlayer of support to services that are already provided by the primary team to help with issues that people with serious illness have specifically.
Issues such as?
A lot of it is symptom management. We do a lot of pain management. We also help with shortness of breath, nausea. We do help with anxiety and depression. We do a financial assessment, and we have a whole team that helps deal with these things as well as spiritual matters.
Well, you touched on this just a second ago. Who provides palliative care?
Palliative care is designed to be provided by what we call a multidisciplinary team. Here at UT, we have a physician, we have a nurse, we have a social worker, as well as a part-time psychology team. We have our own chaplain and our own administrative person. Some palliative care teams also have pharmacy, physical therapy, occupational therapy as well. And so every team is a little bit different, but the main concept is that it's an entire team coming together to help provide this support.
And so what are the benefits of palliative care?
Palliative care has been shown to have many benefits. Among them are improved symptom management, improved communication among family members, among team members of other specialties. Palliative care has been shown to improve quality of life, and also it's been shown to actually possibly extend life in some cases.
Well, so if a patient wants this kind of care, if he wants palliative care, can he or she continue to receive treatment for the underlying disease?
Absolutely. That's what palliative care was designed for. And so we still try to kind of keep ourselves to the side, meaning that we don't ever want to completely take over the care, but we want to leave that care up to the primary doctor, whether that be the oncologist, if it's cancer, the family doctor, the internal medicine doctor, and they can still get any treatment recommended by their primary doctor at the same time that they see us.
Well, let's have some examples of the kinds of cases where palliative care would be appropriate. You mentioned cancer.
Yes.
But other types of situations where palliative care is appropriate.
Yes, absolutely. So palliative care was kind of born out of cancer in its beginnings, and that's still mostly what we see. But palliative care patients are end-stage COPD, heart disease, lung disease, liver disease, pretty much any disease that is a serious one. Anything could be palliative care.
You touched on this a moment ago, but let's give it a little bit of color. Who's on a palliative care team and how does it work?
Our palliative care team has myself, we have a nurse coordinator, we have social worker, chaplain, and a psychologist.
And how does all that work together?
We meet daily. Every morning we talk about the patients that we're going to see that day. We have weekly meetings where we go over patients and issues that we've come across that week. We communicate frequently as a team with the primary doctors, usually oncologists, and talk about issues that may have come up. For example, if I'm talking to a patient and I come across what I think may be a spiritual issue, then I bring it up with my chaplain, and then he makes it a point to provide some extra spiritual support, for example.
I think you made this clear, but let's draw a line under it. Does a patient receiving palliative care have to give up his or her own personal physician?
Absolutely not. We would actually hardly ever become the primary doctor, and we always want them to keep their primary doctor.
What does palliative care mean to family members and caregivers?
What we typically hear from family members and caregivers that have received our services is that they're usually very grateful for the extra layer of support that they get from our team, the extra communication that happens between us, the family, and also the primary team. We try to provide kind of a better coordination of care so that everybody is on the same page.
Some people might get confused here, so let's make sure they don't. How is palliative care different from hospice care?
That's a good question. There is a misunderstanding that palliative care is the same thing as hospice, and that confusion is because palliative care, let me word that differently. Hospice is encompassed by palliative care. In other words, everybody that is receiving hospice is receiving palliative care, but not everybody receiving palliative care is receiving hospice. And so we do see people towards the end of their life and manage end-of-life issues, but we've extended that out to include them months and years before they reach the point where they're eligible for hospice.
Does insurance typically cover palliative care?
It does. It does. Just like insurance would cover any other specialty, we usually have no problems with that.
Palliative care teams, are they common? Do all hospitals have them?
They are not common. So far, only large hospitals typically have palliative care teams, but palliative care is one of the fastest growing areas of medicine, and it's becoming more and more incorporated into hospitals around the country.
If a patient's interested in this type of care, what should he or she do?
The best thing to do if you're interested in getting palliative care would be to speak with your primary care doctor and see if they know of a way to get a consult and to come and see us. We're not the only palliative care team in Tyler. There are others, and so one barrier may be that your primary doctor doesn't know how to contact us, and so just if you want to come see us, call the main hospital. But again, there are others in Tyler that you can see as well.
Very well. Doctor, thank you very much for your time.
Absolutely. Thank you.